Am I audible?
Yes.
So, good evening, everyone, and thank you for making it to this session. So, today we'll be discussing with our seniors from 20 batch and Gautam Chelani sir, who is currently doing PETS in PGIE Chandigarh, on how to make maximum out of internship. And also I would like to congratulate Vidhi ma'am and Tejas sir for securing AIR 10 and 11 respectively in IMA 2026, sorry. So first, I would like to start with Tejas sir. Sir, we would initially want to know what was your preparation strategy and how did you manage between the light postings and the heavy postings? Like, what would you like to advise to your juniors regarding it? Like the preparation, if we have to focus on a NEET PG and INI set.
Hello, am I audible?
Yes, sir, you're
Hello.
audible. So it's a little low, but you're audible.
Okay, so for NICT, mainly I think uh, during internship, one should focus on revising your first and second year subjects very well. So I think our audience would mostly be final year students who just either entered their final year or they've passed their exams. So you would have covered, I think,
Yes,
most
sir.
of the final year subjects. But you'll realize in the NICT examination, I think this is common knowledge by now, they tend to disproportionately focus on your pre and paraclinical subjects to the extent that many of the supposedly clinical questions are also based, rooted deeply in fundamental scientific facts which you read in your first and second years. So previously, if you've read some good standard books, at least Genong for physiology, including all the graphs, and Robbins for pathology. Like I can tell you, this time also in the NICT, there was a graph of filtrability through the GFR, and they made that graph including polyanionic, polycationic, and neutral dextrans. So basically, how a charge affects the filtrability of ions. That is directly from Genong. Similarly, there was an image of GERD which sparked a lot of controversy. Many students thought that it may be dysplasia. Even I started second guessing myself, but I marked it GERD only, and then later on I realized that that image was directly from Robbins. So the images given in Robbins and the graphs in Genong, in fact, even Shiveha ma'am shared a PDF which had all the graphs. So I think you need to cover these two books at least. If you've done that, please revise them at this stage. And whenever you find time in the light postings, other than that, keep giving GTs while they are live, no matter how tough your posting is. And please remember that out of 52 weeks, only 6 weeks of medicine are hectic. Rest of them, all of them are pretty doable. Many of them are 8 to 4. You've managed those working hours even in your second years. Once you start getting used to the night duties and the post duty off, then you'll adjust. So give yourselves time at the start to adjust and take time out in medicine in particular just to take care of yourselves, your physical, mental health. And other than that, keep yourselves grounded, healthy, and focus on your fundamental subjects and practice problem solving through GTs and Q banks, and especially the previous year questions of INI.
And sir, like, how did you utilize the time while you were on duty? Like, the many time blocks that we get, were you able to utilize that? And if there is any efficient way to utilize them, or should we entirely focus on the clinical work that we are expected to do at that time? What is your take on that?
भाई, जो भी करो ना, मरीज का नुकसान मत करवाना। बाकी का टाइम जो मिल जाए उसमें अपना ध्यान पहले रखो, और उसके बाद जो भी हो, जैसे मिल जाता है टाइम, आप पर्चे बना रहे हो, वो कर रहे हो, उसमें आप क्या क्या चीजें कर सकते हो। आप मैरो के बुक मार्क्स देख सकते हो जो आपने करे हो, या कोई भी प्लेटफॉर्म के बुक मार्क क्वेश्चंस, या फिर आप वो देख सकते हो आंकी के कार्ड्स अगर आपने बनाए हैं, या फिर आप वो देख सकते हो कोई पर्ल्स वगैरह। या फिर मैंने जैसे एक और चीज करी थी, मैंने बुक्स के टॉपिक्स के बड़ी सारी फोल्डर्स बना रखे थे गैलरी में, जैसे मैं फोटोज खींचता था, और वो कई लोग आईपैड पर ऐसे बनाते हैं। तो आप वैसे उसमें वो चीज देख सकते हो, यू कैन ऑलवेज गो थ्रू ऑल दैट, नॉट जस्ट हेयर। आई वॉज ऑल्सो डे स्कॉलर, सो आई इफेक्टिवली यूटिलाइज द टाइम मेट्रो में और इस समय while ट्रैवलिंग ऑल्सो डूइंग ऑल दिस, सो यू कैन यूटिलाइज ऑल दीज इंटरस्टिसेस, बट बाय एंड लार्ज डोंट कॉम्प्रोमाइज ऑन योर वर्क, मतलब अपने को इंटर्न्स और मरीजों का नुकसान मत करो बस।
True, sir. And this was really helpful. Coming to Vidhi, ma'am. Ma'am, can you tell us about the resources that you used during your internship for the preparation of NEET and INA?
सोर्सेस तो ऐसे ही कि जो मतलब नोट्स थे वही रीड करा था। तो मैरो से किया, मतलब जहाँ से भी पढ़ा है वहीं की सोर्सेस से दोबारा रिवाइज करने की कोशिश कर सकते हो। ऐसे बिल्कुल लास्ट में तो सिर्फ आरआर भी फ्लिप थ्रू कर लिए थे, तो वो भी बहुत जल्दी जल्दी हो सकता है क्योंकि 80-100 पेज होते हैं, तो वो बहुत जल्दी जल्दी देख लिया था। मतलब अब पर अपने
Ma'am,
नोट्स
would you
ऐसे हो
like
तो
to
वो देखना ज्यादा आसान है दोबारा।
would you
हम्म।
like to elaborate on which postings, like among all the postings, among all the departments, like which department posting should be entirely focus, not and focus on the theory, but entirely focus on the clinical work that we have to do, and which postings can we utilize in the best way in order to prepare for the exams, so as to get a balance among the studies for preparation also and among the internship also that we have to do.
वही कि पीएसएम, मतलब वही जैसे तेजस ने बोला ना कि मेडिसिन के अलावा, मतलब मेडिसिन में तो नहीं कर पाई थी मैं कुछ नहीं कर पाई थी सच्ची में। उसके अलावा बहुत सब में स्कोप है करने का, जैसे पीएसएम बहुत सारा सारा खाली है, मतलब उसमें लिटरली बहुत सारा टाइम है।
Yes, ma'am.
और बाकी रेस्पिरेटरी मेडिसिन वाला टाइम, साइकी, ये सब रेडियो, ये सब में 2-2 हफ्ते वाली होती है खाली। कोशिश करी जा सकती है, अगर लगे भी नाइट के बाद पीडीओ भी छुट्टी लगे तो, अगर तो इसमें भी थोड़ा सा काम करा जा सकता है, सिर्फ एक जीटी तो दिया जा सकता है। और तो सर्जरी भी
Ma'am,
खाली
like
होती है,
you,
क्योंकि सिर्फ
yes,
सर्जरी भी खाली होती है क्योंकि उसमें सिर्फ 6 6 आवर्स के स्लॉट्स बने हैं, तो बाकी के टाइम तो खाली है।
ma'am. True, true,
तो
yes,
है,
ma'am.
काफी टाइम है, इस मेडिसिन के अलावा तो काफी सब में टाइम की जगह
Ma'am,
निकल सकती है।
your first revision was completed in how many months? Like first read.
वो तो हम सब करते हैं ना
Hello.
फाइनल ईयर के पेपर के वक्त, मतलब तो तभी। हेलो।
Yes, ma'am. Yes, ma'am. You're audible. No, ma'am. As in,
तो
like,
शायद वो थोड़ा
in
बैकग्राउंड
final
में।
years, no problem, ma'am. In final year, we already did one read of the subject, but when we thought of like strictly preparing for the competitive exam as well, so like then in how much time did you decide that once again I have to complete the first read in this much month and then revising it again and again
मुझे लगता है
until
कि
the final exam?
इंटर्नशिप, मुझे लगता है कि पूरे साल में बहुत सारा टाइम है, तो अपने पेस पर बहुत अच्छे से वो मतलब फिट इन किया जा सकता है, आराम आराम से पढ़ने में भी अपने नोट बहुत आराम से पढ़े जा सकते हैं। और उसमें सबको पता होता है कि उन्हें कितना टाइम लगता है, तो जैसे गाइनी अगर है, किसी को लगता है कि वो अपने नोट्स ऐसे 2-3 दिन में पढ़ लेगा तो फिर अच्छी बात है, हो गया एक साइकिल में पूरा। मैं
Okay, yes, ma'am.
अम, बहुत ऐसे प्लान कभी कर नहीं पाई हूँ, मतलब सच्ची में भी।
Ma'am,
पर
you
मुझे
did
लगता
very
है
nicely
कि
since starting of
पर
the
मुझे लगता है कि
MBBS.
अपनी तरफ से पर मुझे लगता है कि अपनी तरफ से हम सभी कस्टमाइज कर सकते हैं बहुत सारी चीजें, हमारे पास लिटरली बहुत सारे
True,
सोर्सेज हैं,
true.
इंक्लूडिंग मैरो में भी 1000 तरह से आप सवाल ले सकते हो। आप सब्जेक्ट टेस्ट, मिनी टेस्ट, फिर कस्टम मॉड्यूल बनाकर पीवाईक्यूज अलग से, जीटीज तो है ही, क्यू बैंक अलग, तो बहुत सारी चीजें हैं और वो सबके पास है। हम सब वो सब कस्टमाइज कर सकते हैं अपनी तरह से खुद करके। मैंने तो बच्चों को वो पर्ल्स भी यूज करते हुए देखा है, वो फ्लिपकार्ट्स होते हैं वो सब बनाते हुए देखा है मैदे से। वो सभी काम की चीजें हैं, सबके पास है।
Did you also
मुझे
use
लगता है
Anki
कि
flashcards or any flashcards?
नहीं, मैंने नहीं करे थे, मुझे नहीं आदत है उन सब चीजों की। मैं लैपटॉप टैब से नहीं पढ़ती, पर वो कर
Okay,
सकते हैं
thank you, ma'am.
क्योंकि वो अच्छा होता है।
Yes, ma'am, for active recall and all things. Oh, my next question is to Gautam sir. Gautam sir is currently traveling in train, so it might not be possible for him to speak up. He might text in the comment section. Uh, Sir secured Air 109 in INI 2025. So, sir, in the May and the November INI, would you like to Hi, sir. So in the May and the November INI attempts that you
Uh,
gave, uh, what was there that you thought was lacking in the November INI that was like corrected in the next INI? And is there any advice that you would like to give so that juniors don't repeat the same mistake?
So first of all,
Hello.
thank you for inviting me.
Yes, sir.
Am I audible? Am I audible?
Yes, sir. You're audible. Yes, sir. Yes, sir. You're audible.
So uh, yeah, okay. So basically, November INI was given. So I had given my INI like after the internship and like after 6 months of like rigorous preparation, or rigorous or in the sense focused preparation, I gave the November INI. So one thing I
Okay.
like did different. Have I should have
Sir, your voice is lagging
haven't I
slightly.
have another. Okay. So is it hello?
So, not good.
Is it better now?
Uh, yes, it is better.
Yeah. So I am saying that you should have a mindset that like there's another exam that you can give. Like for example, like we had NEET PG also. And so you should not like just
Yes.
have that like "Okay, this is the last exam I'm giving and like be scared that if I don't do well, then what? You shouldn't have that mindset. You should have that even if I don't do well, I have another chance to give. So that takes the pressure off your mind. At least that's what it did for me during my November INI because I had already gotten a college through NEET PG. So I thought like, okay, fine. Like even if I give don't do well in this, I still have a seat. So this gave me a bit of relaxation during the exam. Secondly, as Tejas has pointed out, that first and second year are a major component. Approximately 60 to 65% of the questions are from first and second year. So focusing on that. And yes, focusing on the tables, diagrams of Robbins and the Genong and even Bailey and Love, I would say, would help me during क्या कहते हैं, my second attempt. Uh, I think these were the primary things which helped me. Other than that, like giving more and more GTs was beneficial, and that analyzing them in a proper way was something which I did. So that like when you're analyzing a GT, that is also very important. Like giving a GT is important, and then analyzing it is much more important. Like for example, like when you are like reviewing a GT, you'll have three types of questions. One you have like first type which you have done correctly. Secondly,
Right.
which like you have done incorrectly. Third type would be the one you have guessed. So the ones you have guessed, like you should consider them as you have done incorrectly because in the main exam it may be there that like by luck you have got this question correct in the present GT, but if that question was twisted, you might get it incorrect in the actual exam. So
True.
you should ensure that you revise it as an incorrect option so that you are ahead in the actual exam. You should maintain a notebook. Like I had maintained a notebook of all my mistakes which I am doing. And like another way to analyze a GT is seeing like which type of questions you're doing incorrectly. Like for example, if you're doing previous questions incorrectly, that is like क्या कहते हैं, not desirable. Like you when you were giving a GT, you will see like there are tags. Like it is there like a NEET PG, recent NEET or AIMS tag. So you should see
Yes,
that,
sir.
those questions are previous year questions and on based on previous year topics. So like because you will see that INICT is like based heavily on the previous year topics and previous year questions. So like it is for an actual exam, so you should not be making mistakes in the previous year questions and the previous year topics. So you should look for those क्या कहते हैं, hashtags when you're like analyzing a GT, and you should also solve the previous year questions, and like in during the custom modules, see that those tags are always used. And like uh, basically one thing I would advise is like to focus on previous year topics and the previous year questions, and try to like integrate them in all your custom modules and make a note of all the mistakes you're making. That's what I would say.
Okay, sir. So this was very helpful. So there is one common question to you with the environment pages, sir. Like, when did you start giving the GTs? We have heard that irrespective of the amount of preparation that you have done, you should start giving it since the start of the internship, so as to like get a know of where you actually stand. Or should we give it after we are a little confident about like at least covering the first pass of the syllabus and then start giving it towards the end? So how did you guys do it, and like what would you recommend to us? Starting from Tejas, sir.
Like I had
फिर आप बताओ, मैं फिर बताता हूँ.
नहीं, you should go ahead. That doesn't matter.
Man, so I've been giving
Anyone?
GTs ever
Yes,
since
sir.
my third year, all of them. And
Oh
because,
my God.
and I think just like quizzes and GTs, you can never be prepared to handle all of the questions solely based on your theoretical knowledge. But then you have to somehow figure out how to deal with the rest of them, the unfamiliar things. How do you sift out dummy options? How do you eliminate certain choices? How do you narrow down? How do you how do you become better at decision making? What to leave, what to attempt, कहाँ तुक्का मारना है, कितनी probability है, वो सब चीज़ें भी बड़ी ज़रूरी हैं, I think. And in fact, I would say I would credit my
Hmm.
selection mostly to my aptitude or problem solving skills, and also that luck on the day of the exam, rather than my theoretical knowledge, because all the students in top 1000 for sure have excellent grasp of their theory. Only thing that differentiates them on that day is how they manage to attempt all these tedious questions, and how they manage their time, how they maintain their stamina for 3 hours. All this experience can only be, you can get all this only through GTs. So I think you give it as early as possible. You use it as a learning tool. Don't compare yourselves to others. That is another criminal mistake that one can do. Because there were people, I asked Gautam sir कि भाई सर बच्चों के 192 आ रहे हैं, सही है, 185 आ रहे हैं, 180 आ रहे हैं, मैं 160 आ जाते हैं मुश्किल से, 170 कभी एक आध बार छुए हैं, 150 से ऊपर वैसे रहते हैं. वो कहते हैं वो सब एग्जाम के दिन देखना, वो दूर दूर तक कहीं नहीं दिखेंगे. वही हुआ. तो अपना करो, यू कैन यूज इट एज अ लर्निंग टूल. उसमें जो
Yes,
बॉटम
sir.
3 बॉटम 5 सब्जेक्ट्स हैं वो रिवाइज कर लिए आप. another thing you should use, Gautam sir explained very well how to analyze the GTs. You spend time on it. मुझे एक वो चिंता होती थी कि भाई बड़ा टाइम लग रहा है, वो टाइम वेस्ट नहीं है, दैट इज फ्रूटफुल एक्सपेंडिचर. एंड डू इट एज सून एज पॉसिबल, जब तक आपको अपने मन में फ्रेश है क्या आपने पॉलिसीज थी आपकी थिंकिंग में, ताकि आप वो समझ पाओ. बट ऑल्सो वाइल अटेम्प्टिंग द जीटी, दिस इज द लास्ट पॉइंट, प्लीज यूज दैट फीचर ऑफ मार्किंग फॉर रिव्यू. नहीं, एक और भी होता है, आई थिंक दैट यू हैव गेस्ड इट. तो वो एट द एंड प्लीज एनालाइज कि जो सवाल आपको लग रहा था 100% सही है, 140 150 जितना भी, उस सबसेट में आपको अपनी सिली मिस्टेक्स मिनिमाइज करनी है. और जो आप गेस मार रहे हो उसमें आपको अपनी एक्यूरेसी बढ़ानी है प्रोग्रेसिवली. तो ये फ्रैक्शंस भी थोड़ी देखो ग्रॉसली.
Right. Okay, sir, got it. Got this point. And ma'am, like Vidhi ma'am, you also started giving since third year itself.
No, since final year. Hello.
Oh.
मैंने तो final
Yes,
year
ma'am.
से
Yes,
किया
ma'am.
था.
And sir,
I had
Gautam, sir,
started
you.
and I had started during the end of final year only. But I would say that it doesn't matter when you start to give. The important thing is you start to give because it is because everybody fears that my preparation I will but your page will never be complete. Okay. So like there and like the start like when you give the GT doesn't matter because like I'll give you a live example. So like some of my friends had started with me only and like we got similar ranks. One of my friends started later, but he was during the May I and I won't in the names, but yeah, they got veterans than me, and like some had started even earlier than me, and they had like I had performed better than them. So it actually doesn't matter when you start to give. The important thing is you start to give, you analyze your mistakes, and like just remove the fear of that GTs. Like just remove the fear of the main exam. That is, I would say, the main point I would like try to convey here.
Got it, sir. Right. So now we'll move on forward with a different section, which is equally as important as these exams, which is our health. I would like to question Ritik sir. We all know that sir maintains a very good physique and is very disciplined about gym and diet. Even during internship, when we have such uh, difficult sleeping hours and like it is barely possible for us to maintain and give justice to the diet that we have. Like, sir, how were you able to manage it all? Health is equally as important as our academics. How were you able to manage it?
Hello everyone. Like initially at the end of final year, I ending putting a lot of weight. So in medicine also, my first internship posting medicine ही थी. तो उसमें भी मतलब मेरा काफी वेट गेन हो गया था. तो फिर मैंने मेरे फ्रेंड्स वगैरह ने सजेस्ट किया था कि तुझको थोड़ा ये सब भी करना चाहिए फिटनेस वगैरह. तो मैंने पीएसएम से स्टार्ट किया था ये, जो लाइक सितंबर में मेरी स्टार्ट हुई थी सर्जरी पीएसएम से. तो उसके बाद तो मतलब जैसे तेजस्विनी ने बताया था कि मोस्टली पोस्टिंग 6 आवर्स की होती हैं. तो उसमें 1-2 आवर्स आराम से निकल जाता था जिम जाने के लिए और डाइट वगैरह के लिए. तो उसी सब से इजीली हो जाता था ये सब. तो
So during
हेलो.
but
यस.
during internship, it must have been very hectic, right? Like,
यस.
yes, sir. Am I audible?
यस. यस.
Sir,
यू
during
आर ऑडिबल.
internship, it must have been very difficult, right? Because duties are not like 12 hours or even more sometimes.
यस. हाँ ऐसे ही होता था मतलब कभी
Hello.
ड्यूटी 12 आवर की नाइट. हेलो. एम आई ऑडिबल. हेलो.
Yes, sir. Yes, sir. Yes, sir.
हाँ मतलब ऐसे ही होता था जैसे ड्यूटी कभी
So you're
मॉर्निंग शिफ्ट
audible.
में होती. हाँ मतलब जैसे ड्यूटी कभी मॉर्निंग शिफ्ट में होती थी, कभी इवनिंग शिफ्ट में होती थी, नाइट होती थी, 12 आवर्स होती थी. पर मतलब मेरा एक फ्रेंड भी था तो हम लोग टाइम निकाल लेते थे. जैसे मॉर्निंग में हुआ तो इवनिंग में जाते थे, इवनिंग में मॉर्निंग में, मतलब हो जाता था अगर मतलब विल हो तो इजीली हो जाता था. और पर हाँ स्लीप वगैरह तो थोड़ा कॉम्प्रोमाइज हो ही जाता है उसमें. पर फिर भी मतलब कर लेते थे कि अपना टाइम उसके अकॉर्डिंग शिफ्ट कर लेते थे पोस्टिंग के अकॉर्डिंग. और मतलब मेडिसिन वगैरह में मेनली 12 आवर्स की ड्यूटी
Priorities.
होती है. बाकी सर्जरी पीएसएम जो 2 वीक्स पोस्टिंग्स होती हैं उसमें तो मेनली 6 आवर्स की मोस्टली ड्यूटी होती हैं. मतलब वीक में 1-2 ड्यूटी होती है 12 आवर की. तो फिर हो ही जाता है मोस्टली इजीली.
Yes, sir. Got it. One more question is there, which is to all the seniors who are here. Apart from the exams that we have to prepare and everything, we also want to make the maximum in terms of gaining the maximum clinical experience and not being just skirt workers in different departments. how were you able to do it, and like what are things that you think you might have not done but you would like your juniors to advise on, like to make maximum out of it clinically to actually become a good doctor? And because internship is loaded with just skirt work, so we want to move a little above it. If like how were you able to do it? We can start with Aman sir. Hello, am I audible?
Yeah, you're audible, Aish. Uh, so to getting the maximum out of clinical work for internship, I would say that you have to be proactive. You have to be showing that you're interested in whatever branch it might be. Like even if you are not interested in peds or anesthesia or any branch for that matter, you have to show that you're interested. Um, and you will be interested because you have, especially like you guys have recently studied all the subjects. Um, so it does get interesting when you actually see the patients and the diseases, the pathologies in the clinics. Um, but with that said, like usually your seniors, they might not reach out to you to, they might not go the extra mile to teach you something. Uh, so for that, you will have to show your interest. Um, Whatever procedure your seniors might be performing, uh, whatever cases they might be discussing, you can just show that you're interested by asking questions, by simply asking them that can we assist or can we do, uh, and they that way your seniors will also know that you are interested and they will provide you more opportunities to learn the clinical work and to get the most out of it.
So the lesson is proactiveness, basically being as proactive as possible.
Yes, it's
Would
easier
other
said than
seniors like
done
to add
because
something to it? We are very much lethargic by the time internship finishes.
yeah, definitely.
Would others like to add something to it? Ritik sir, Tejas sir, Vidhi ma'am, Gautam sir.
I think another thing students can do is they can make a list of skills which they want to learn at the start of each new rotation. For instance, in surgery, basics
Interesting.
suturing of scalp laceration, or even now, depending on your unit, you may get to insert central lines, or you may get vinisections or such procedures. And then in the first week, you probe and you see who are the PGs and SRs who are willing to teach and give you hands on, and then you can proactively approach them in future. But on day one, you can chart a list. In fact, I advise this to final year students, third year students also. What sort of cases do you want to see and present? So have that in mind beforehand, and then try and get that done like a checklist till you are confident. And also, please realize this is a golden opportunity. It's a buffet laid out for in front of you of 19 subjects. And once you choose your specialty, you will never get the opportunity to go back and practice those other skills. So प्लीज मेक द मोस्ट ऑफ इट. बट ऐसा भी मत सोचो कि वो स्कट
Yes,
वर्क
sir.
या वो धोखा है, क्योंकि 90% काम किसी भी जगह पर वो ही होता है, क्लरिकल, और वो जो बड़ा जरूरी है. वी आर ऑल कॉग्स इन द व्हील, and that is also pivotal. For instance, there
Right.
was a case of parathyroid adenoma being operated in our unit. So Shanto sir was operating it. So my role was just कि वो सबने पढ़ा होगा मायामी क्राइटेरिया कि 10 मिनट में 50% ड्रॉप होना चाहिए तभी सक्सेसफुल कहलाई जाती है सर्जरी. तो मुझे बस उनके पाँव से एक सैंपल निकालना था, भाग के मुझे लैब में पहुंचाना था. तो अब वो काम कहने को स्कट वर्क है, बट उसी आधार पर ये निर्णय लिया जाएगा कि सर्जरी कंप्लीट हुई, सफल हुई या नहीं. तो वो काम वो भी बहुत बड़ा है.
That's an
उसके
entirely
बिना
different
पूरा
perspective
वो
to see it.
अपूर्ण है. हाँ, तो मतलब निराश नहीं होना वो देखकर. और but yeah, a lot of it is being at the right place at the right time. सो जैसे जब
Hmm.
नए पीजीज आएंगे तब थोड़ा वो होता है कि उन्हें हैंड्स ऑन ज्यादा देते हैं, बट जब आपके वाले पीजी फर्स्ट ईयर्स जैसे when they are nearing the completion of their term then they are more likely to give you more procedures, but बाकी वही आपको देखना है कि sometimes you are competing with JRs or first year PGs, मतलब instead of that competition मतलब you look for your opportunities and you figure out who are the people who are better at teaching and giving you. Another thing I have learned a lot from all the nurses and the sisters in all of the skills, जैसे मुझे कॉन्फिडेंस ये कैनुला डालने में, मैंने सेंट्रल लाइन भी पहली अपनी इंडिपेंडेंट सिस्टर जी के साथ डाली है वार्ड,
Oh,
जो हमारा था यूनिट 6 का, तो उनसे बहुत कुछ आप सीख सकते हो। तो मुझे तो मतलब धीरज ब्रदर जी,
yes.
रूडी सिस्टर में, कैजुअलिटी की जो सिस्टर हैं वो, and I remember the sister at our time, one of the sisters was pregnant, so she was very careful while uh, inserting cannulas for वो unknown patients, because obviously वो risk of all the HIV HBV, so उनका इतना साफ
Universal
इतने तरीके
precaution.
से वो काम करती थी, वो मतलब उनका हाथ इन चीजों में बेटर होता है देन इवन डॉक्टर, सो यू कैन लर्न फ्रॉम ऑल दीज सोर्सेज, तो ये सब का ध्यान रखना।
So it entirely depends upon way of looking how we are seeing things and how we are accepting and learning from it. So thank you, sir. Now I'd like to move forward with the questions which are there in chat box. So first question is, did you use any USMLE study material like first aid for preparation, and did it help you, especially for the first, second year subs? So take off all the seniors on this. We can start with maybe Vidhi ma'am.
No, I didn't see any of these studies.
Did any of one of you use the first aid in your preparation?
I did get
No,
it,
I
but
guess.
I didn't use it extensively
Use
because
it.
I've the sources on which it is based, I've read those, and I'm not, matlab, I did not rely a lot on the mnemonic and all, but a very good resource because it sums up all 6 subjects, and not just that, a bit of biostats also, a bit of ethics also. It's a good resource, but then you have to add on and annotate at the sides from Robbins and Harper Ganong, all the books that you read.
So it's
And I think later on
so
you
it's better
can,
to
if you
annotate
are
it in the
using it in
original.
internship, then please add on to it using the custom modules and all the modules that you solve. It's a good resource.
Okay,
Another
okay.
good resource is the even Hussain Sattar's Pathoma videos, and they are very useful as a
Yes,
summary.
sir.
So sometimes I used to use them before reading the chapter just to get a layout of what all is there. And also Dr.
Interesting.
Gojlan's videos and his book is also there in the library. So he has explained Robbins and in a way that you cover a lot of the medicine part also. So all of these are good resources. I have a limited experience with them, but you can use them. And I think sooner than later, not don't switch resources at this stage if you haven't used them
So your
already.
final revision was so your final revision was from where? Were it the coaching notes that you annotated and had read since third, fourth, final year, or it was the
I
original notes that you yourself made from books, standard textbooks?
I am in the bad habit of not sticking to one resource and wanting to getting very bored of, and it gets very stale for me if I stick to the same resource. But for me, in the last 2 months, to be honest, I've practiced more questions than actual reading. So Shiveha ma'am
Okay.
advised me to get this app Reflex, on which there are INICET questions starting from 2011, 8,500, 9,000 odd questions. So I
Oh.
did all of, I revised my bookmarks, and I attempted many GTs from various platforms, all the free ones. Cerebellum offers many free
So sir,
GTs otherwise towards the end. So I mainly just practiced questions and I analyzed them, and
Questions.
I created this copy towards the end, which was very good because I think if I had started on that early on, I would have added many things which would have become obvious to me by the end. So I stuck to the copy and I created WhatsApp folders with Vidhi, wherein we would have all the important previous year questions. So 19 groups for 19 subjects. So I had created all of this, and all of this really helped towards the end. So it was last 2 months for me was all about translating the theoretical knowledge into actual problem solving.
Application questions.
Hmm.
Got it, sir. So one of our friend is asking if we can get a list of the must learn skills department wise, as they're aware of the procedures but not sure what all would be possible in the postings that they are posted in. The list of the procedure that they should be skilled. Is there any such kind of list already there?
Yesterday, I was speaking to Lakshya, another of my juniors. So I offered him some suggestions for surgery. But having said that, so I can share that similarly for other subjects also. I think we can put together something. But to be honest, the sky is the limit. For instance, Vidhi performed hydrocele surgery also from skin to skin, and oh, and during her time, the
Wow.
PG2s were had the PG1s were on the verge of becoming second year PGs. New PGs were not there, and then they came in when my posting started. So it is all up. You can do anything that you want. You have to be willing, but I can still put that together. But I think I'll work on it gradually. But we can certainly do
Okay,
that.
so it would be great if you can share with us after that.
Hmm.
Uh, so one last question, like how to manage the hectic duties with the studies? What was the motivation? Was it the rank, or like did you expect to get a such great rank? Was it already that you want to get into top 10, top 100, or what was the constant motivation? Or was it that you have to clear it in the first go? Like after, like among the hectic duties, despite that, if one takes out time willingly to study and go beyond the threshold. So what was your motivation and sort of goal for you when you were preparing?
All of these are factors you have to search for your why. I think it has to be personal and it has to be based on your priorities from life, whatever it is. And then you stick with it. And frankly, I never found internship too hectic by and large, barring the 6 weeks of medicine, because in our ward we had 24-hour duties also. But other than that, all of it was manageable. And I always wanted to stay in the game. So as soon as you've given up or you've abandoned hope, I think at that time you are out. So you look at the noise, there must, I think 95,000 candidates
Stay in the
appeared.
game in what
Many
respect?
of them are not even serious. Many of them have already given up halfway. Similarly, in NEET PG, on all competitive exams, they've 1 week before, 1 month prior, they've decided, okay, this is my internship, this is my rough attempt, this is just for all of that. They've already lost the battle before even coming out there. So don't do that. Don't count yourselves out. All of you have an excellent chance of cracking it. This exam, had they conducted had the 10 separate exams, I'm sure the ranks would have been jumbled up. I could have just a matter of 5 6 questions and I would have had a rank with which I wouldn't have gotten anything. And that is the case with everyone. Many of my friends are stuck in that region where there is a lot of clustering. So please back yourselves, believe in yourselves above everything else. That is what I did. Every day, small incremental
Very well said.
things that you do to enhance your prep go a long way. It
True,
is a
sir.
long marathon. You can
Like, so
always
in the audience, And like one has to start preparing from a very beginning in order to get such great ranks. It will not be possible in just mere few months, right? So, in the audience, if anyone wants to question to any of our seniors, they can unmute themselves and ask their questions. Yes, Vihan, you can unmute.
Yes. So good evening, sir and ma'am. My name is Vihan. I'm third year student. So I had a doubt ki should we make our own notes for all the 19 subjects for studying or revising, or can we use the ready-made notes of different types like the detailed ones or the RRs and other resources which are also there of different platforms? First question is this, and second is that how to inculcate the standard textbooks for like some particular subjects into our preparation.
You are third year student ना, so the RR notes are not for you certainly. तो आप आपको जैसे सूट करे उसके हिसाब से, मतलब जैसे मुझे शौक है, मतलब अभी नहीं है, पर मुझे शौक होता था सेकंड थर्ड ईयर से तब पहले कभी ऐसे चार पांच कलर से नोट्स बनाने का रंग बिरंगे से। तो किसी किसी को वैसे है तो फिर बाद में अपने नोट्स पढ़ के बहुत सुंदर लगते हैं, जैसे मुझे अभी अपने नोट्स बहुत अच्छे लगते हैं। तो वैसे भी बना सकते हैं, पर मैंने रीड भी करे हैं, बने बनाए प्रिंटेड नोट्स भी। तो वो भी वैसे अच्छा ही काम करते हैं, उतना ही सही लगा है मुझे उनके साथ भी। दोनों यूज कर सकते हो। मत बस अपने वाले नोट ज्यादा सुंदर कलरफुल बनाए जा सकते हैं तो वो अच्छा लगता है। आप ऐड कर सकते हो बुक का, जैसे भी आपने पढ़ा है उसके साथ साथ देखकर कभी भी, वो तो कभी भी आपके नोट्स हैं, आप कभी भी ऐड कर लो।
लाइक मैम मतलब जैसे जो मैं फॉर एग्जांपल मैरो के नोट्स हो गए, तो जैसे आई रीड द मैरो नोट्स एंड उसके बाद अगर मुझे कुछ एक्स्ट्रा इन्फॉर्मेशन मिली या क्वेश्चन बैंक वगैरह सॉल्व करके जो गलतियां हुई, आई लाइक कीप एडिंग देम, कोई जो न्यू इन्फॉर्मेशन है। तो मतलब इज दैट इनफ फॉर, मतलब कि और भी कुछ पढ़ना चाहिए मुझे?
हाँ अच्छा है कि मतलब एक बार ही वैसे पूरा हो जाएगा। आपको लगता है आपके पास मीनवाइल कुछ और सोर्स आता है, कुछ और आपने बुक से पढ़ी कोई चीज, आपको ऐसा लगता है तो आप उसमें वहां से भी पढ़ लो। यहाँ पे आके दोबारा कभी पढ़ लेना, टाइम तो बहुत है। मतलब एक चीज तीन चार दो तीन जगह से पढ़ी हो तो और कॉन्फिडेंस फील होता है कि आपको, कि अब अच्छे से हो गया है।
ओके मैम। मैम एक डाउट और था कि जैसे लाइक एनीबॉडी कैन आंसर ये कि जैसे स्टैंडर्ड टेक्स्ट बुक्स होती है, फॉर एग्जांपल सर्जरी की बेली लव हो गई या मेडिसिन की हो गई या और भी से गाइनी वगैरह की हो गई, तो वो कैसे मतलब करें? क्योंकि मैरो आने के बाद तो मतलब इतना इजी हो गया, मतलब हम सीधा लेक्चर खोलते हैं और फटाफट लगा लेते हैं और फिर नोट्स देके हमारा लगता है हमें सब्जेक्ट हो गया। तो क्या वो असली में हो जाता है सब्जेक्ट पूरा, या हमें स्टैंडर्ड बुक्स भी अच्छे से पढ़नी है?
पढ़ लेना चाहिए दो दो बार, एक बार तो कम से कम, और अच्छा लगता है उससे। आप पढ़ोगे आपको पता लगेगा कि उससे और भी ज्यादा अच्छा लगता है। नोट्स पढ़कर हो जाता है पर वो उतनी जल्दी गायब भी हो जाता है। तो जरूर मतलब खुद से और कॉन्फिडेंस फील होता है जब ऐसे बुक से भी पढ़ो।
गॉट इट मैम, थैंक यू।
Any other questions? Okay, so no more questions. I would like to ask he has joined with us. So what advice would you like to give to the interns? Hello, hello. So are you there?
Aishi, you were not
Audible.
audible. We were not able to understand what question you asked.
There was no question. I was asking if anyone else has any question first. Am I audible right now?
Yes, yes.
Uh, Anyone else has any question to ask us? No, I guess. So I was saying, Dr. Anurag Mishra, Professor, Department of Surgery, is here with us, and I would like request sir to give some advice to the interns, and if he also wants to uh, tell us something about this phase of internship that we are almost about to get into and have got into, many of us.
Yeah, thank you, Aishi. And I think first of all, I'd like to congratulate everyone. All of you here have cleared the final year MBBS exam, and I think some people think that this is the most difficult exam on this earth. So I think it deserves a big applaud and to everyone. You have
Thank you, sir.
sorry.
No, nothing, sir.
Okay,
Please continue.
so the thing is, I think the right advices have already been given, and I really admired, especially Tejas, how he advised and the approach to whole internship. And really listening to the answer, I used to think that the game of entrance has changed a lot, but listening to his answers and the way he approached it, I think the game is still the same. The similar advice we used to give to our immediate juniors, we got the same advices from our seniors, and we followed the same thing: how to approach, how to study, how to balance internship and this. Just few lines I would like to add is we are very used to having a structured study format. Okay, that this has to be done. Like somebody was asking, what are the must-learn skills and something like that. Slowly and slowly, like maybe this will be a transition. Now it is not going to happen like that. In PG, it is not going to happen like that. That this is the must do. This is something. This chapter has to be read. This chapter is not to be read. It is more of experiential learning, and that is what internship is all about. In internship, every day you may learn. Like will be there. You may learn a lot of things on one day. You may not see any new thing on any one day. We still now we go to OPD and we say, oh, today was not a good OPD because there were hardly any interesting cases. They were same like gallbladder stones or something like that. But there will be day when you get very difficult cases, different cases where you have to talk, discuss, and all that. The same is going to happen from now on to you guys. So slowly you'll have to shed off this thing that what I'm supposed to learn and what I'm learning. So this constant thing, overall, the whole graph will go on increasing. And you will see that after final year, I know you have cleared the exam and everything, but I'm sure the confidence to manage a OPD or see a patient and treat a patient will not be there. But just give yourself 6 months in internship. Once you have a good, heavy clinical posting, maybe let's say medicine, and then you will see how you are. So your learning curve will go up like anything. So just be normal, enjoy the course. Everybody's targets will be different, everybody's aptitude will be different, everybody's interest in certain areas will be different. Just play your game. I like the idea of GT, giving them early. Yes, we also used to give. It was not called GTs at that time, but we used to give all India level open tests, and that is not to compare yourself with other people. That is to compare with yourself. So every month or every GT, your rank should improve. That is the whole game. You can start from 4,000, 5,000 rank and you go till top 10. And so don't even compare yourself with others. And enjoy internship. I think internship is very good. Second tip is do not waste time. Internship में टाइम नहीं वेस्ट करना है. अगर क्लिनिकल पोस्टिंग में आपको कहीं भी हो और आपको लग रहा है कि वहां कुछ नहीं हो रहा है, you know, you're just sitting there, study or do something, but don't waste time. This इस ईयर में टाइम वेस्ट करने के लिए नहीं है. ये नहीं होना चाहिए कि आप पोस्टिंग नहीं गए क्योंकि आपको पढ़ना था और यहाँ पे पढ़ भी नहीं रहे और कुछ और हो रहा है. So I think make sure that is happening. You can take time for breaks. You can take times to rejuvenate yourself. All that is very important. Somebody talked about physical health. It's very important. Mental health is very important. Somebody, I think, prioritize that. Do a bit of clinical work so that the patient is not harmed, your colleagues are not harmed. And then take care of yourself and then study. I think that priority order is, I like that. So follow that. So congratulate to all of you, and internship is going to be beautiful, one of the best time and the most you learn in MBBS, so that will be there. I think back to you, Ayushi.
Thank you, clarity into our life, and at least we'll be able to navigate it better than how we would have navigated it had we not heard from you all. Can everyone please switch on their cameras once we'll have a group pic virtual, if you don't mind? Whoever can